What's going on, everybody? We're back with the Real Bodybuilding Podcast. I'm here with Dr.Adeel Khan. He is the doctor of champions and my sports doctor. And I decided to ask you to come on because of all the great stuff you're doing. You are in Dubai right now. Tell me what you're doing in Dubai.
What am I not doing in Dubai is a better question.
How did you go from almost, I guess you were an assistant to
pretty much. Yeah.
When I met you, and then all of a sudden now you're like on top of the world, treating all these professional athletes, and like you're running the show.
Well, not just professional athletes, the royal family, the king,
the royal family and the king.
Yeah, so it's pretty wild. I've been here a week and I've already had the royal family reach out to me and they want me to treat them. So
come on,
it's pretty crazy. Yeah, no, it's wild. It just word spreads, I guess. And like I got flown first class to treat Mohammed Alabar in March. Mohammed Alabar is the most famous man in Middle East because he's the owner of Emaar Properties. Okay. So he owns he basically built the Burj Khalifa and he built all of Dubai. Like Dubai is what it is because of Mohammed Alabar. Like he was the visionary behind Emaar, and because of that, the 6 tallest buildings in the world are in Dubai, and those were all owned by him. Wow. And he was a visionary behind the Burj Khalifa as well, and making Dubai like. He basically, when I treated him, I was asking him, I was like, why did you want to, like, what was your vision and stuff? And he said his vision was to make Dubai like the best place in the world and attract the best talent in the world. And so I think he's done that successfully because. Just to give you an idea, in the last year alone, 4,000 billionaires have moved to Dubai.
Are you serious? What are you treating these people for? Like, he's not an athlete, is he?
No, so a lot of them are anti-aging or longevity, and that's the new treatments that we're doing now, because it's not just about injuries and pain. It's about living longer and living a better quality of life. And we'll get into that, what type of stuff we're doing. But the point is, it's like the treatments we're doing now are kind of different. Like, I think when we first met, which is why you brought me on again, because I'm doing so many new treatments. Before it was just like platelet-rich plasma, for injections, for pain, stuff like that. But now it's more about longevity, anti-aging, and then even some like genetic testing for prevention. So we're doing a lot of new things.
Okay, so let's go back to the start though, just really quick. I don't want to stay on it too long, but when we started together, you were doing predominantly PRP, which is platelet-rich plasma. Can you explain briefly what that is for people who don't know what PRP is and why we were using it?
Yeah, so the idea is we're trying to heal your body's muscle or tendon tears without having to take surgery or without having to just take pain meds. We basically just take your blood, we spin it in a centrifuge, it concentrates what's called the platelets, and platelets are lone regenerative molecules that help with healing and regeneration. Okay. So by concentrating them, you're essentially going to have more growth factors that get released. And so the idea is you're using your body's own immune system and the cellular signaling that gets released from platelets to try to heal your body.
Okay, so I have a question though, and I don't want to push back too much, but I just want to ask you. So I know firsthand that PRP works because I've tried, like, once I had an injury in my front delt, and I tried to just wait and not train chest and like let it heal, and it just wouldn't heal for like 3 months. After getting PRP, I was back to benching like 315, 405 within like 5 or 6 weeks of getting the treatment. So I know it works. But the question is, there are doctors out there that say it's a waste of time. So what do you say to those people or those doctors?
Well, I say, why did the richest man in Dubai fly me across the world to treat him with PRP? It wasn't because he couldn't find someone locally. There's a freaking 1,000 doctors doing it.
Okay, but other than anecdotal evidence, is there enough studies?
No, but the point I'm trying to make is it's who administers it, how it's administered, and the type of PRP you're using. So you have to have the right doctor doing it. You have to have the right education and training and background. And most doctors are just doing it as cash grabs because it's the easy thing to do. Yeah. But they don't actually know what they're doing. They've been trained by some rep who's just selling some centrifuge and being like, oh, this is how you do PRP. Just inject them and hopefully it works. But there's so much more nuance to it.
No, I actually know you're right, because I have a friend who's gone to a different doctor. Number one, the ultrasound tech didn't find a tear. And then when they did find a tear, the second time they went back, the PRP didn't really help them. And then they went to see you and they've actually had really good success. So how important is the ultrasound tech? Can you start there? Because I know a lot of times someone will go in and ultrasound tech will say there's nothing there. But I know through working with you that we found things that other ultrasound techs haven't been able to find.
Well, even MRIs miss. And that's why here in Dubai, I'm working with like the Royals and stuff like that, because people have nagging injuries and they go in Dubai. Obviously, you can get MRI like tomorrow easily, no problem. But MRIs even sometimes miss small tears. And then we're able to find them on ultrasound and treat it. So the ultrasound technologist or the physician with the ultrasound are able to do dynamic assessments and find things that are missed all the time. So I would say, like, obviously I'm very proficient in ultrasound, but my technologist and me work together to be able to recognize these small tears that are otherwise missed. So I would say it's actually probably fundamentally like paramount to have a good sonographer, because if you don't, you're going to miss things. And if you don't get the right target, it's not going to work.
Yeah.
So, and so it all starts with like the basics, and the basics are actually not so basic. It's like most people actually aren't trained in ultrasound, and even if they are, they've taken like one weekend course. It's just like taking a personal trainer course, right? You can be like, yeah, I know how to do
Yeah.
ultrasound. I took the course, but
Yeah.
it's like, do you really know? Like, there's different tiers and like different levels of expertise, and so
Yeah.
that subtlety is like takes a lot of years of training, and you have to be trained by the right person.
I just feel like that's a really important note for people to take away, because I know so many bodybuilders who are like, yeah, I got an ultrasound, I'm fine.
Yeah, yeah,
But I know, but I'm like, you're injured, so you're not fine.
yeah,
But they went to see somebody that told them they couldn't see anything, so they just left, and then the injury got worse. So
yeah, exactly.
I just felt like it was important to note that for people so that they can understand that they should see a, like you said, there's levels to it. So
Yeah.
PRP also, those used for other things other than injury, correct? Like people are using it for hair and stuff like that. Like, are
Yeah,
they?
I think most people know about PRP now because of cosmetics. Like it's
Yeah.
all over social media, right? For hair, for vampire Kim Kardashian did for her face, so like for
Yeah.
vampire facial and stuff like that. So there's a lot of use cases for it, but as I was saying earlier, the PRP doesn't have any raw ingredients per se, right? You're just taking your own blood, you're
Hmm.
concentrating it, and you're injecting it. So it has to work with your own immune system. So
Hmm.
what that means is it's sending signals to your own body's immune system to start the regenerative process. It's just kind of giving it a boost. It's
I
saying,
see.
hey, start healing.
Okay.
But there's no actual raw material in there, and which is why stem cells are much more exciting, because stem cells, which we'll start talking about now, it's
Yeah.
basically they actually have regenerative capabilities. So
Okay.
what that means is they can actually regrow new tissue inherently, and they can divide into new tissue. So that's the whole kind of excitement behind stem cells, and that's why so many people are talking about it.
Okay. So before we get to stem cells, though, I just have a couple other questions, because you started doing other type injections after PRP, and I know you did some stuff for Paul with his knees. Can you explain just a couple of those different injections that you're doing that are helping
Yeah,
people
yeah,
with
for sure.
injuries and
Yeah,
inflammation and stuff
exactly.
like that?
There's definitely, I would say, like you're right. There's like a pyramid, I would say, almost. So
Yeah.
let's say the bottom of the pyramid is probably like, or whatever way you want to look at it. But with the first line treatment, I guess you could say, is like cortisone. But like I rarely use cortisone because cortisone can weaken tendons, it can weaken cartilage. So it's actually probably more harmful than benefit. And there's actually been enough research on that now. So if your doctor is recommending cortisone, you should probably turn the other way. And unless it's for like bursitis, which is like a very specific condition
Yeah.
where inflammation of the bursa, and it can actually cure that. But for joints and tendons, that's bad news.
Okay.
And then after cortisone, there's what's called hyaluronic acid. So
Okay.
that's basically collagen, which
Hmm.
is like a lubricant that can buffer the joint, which is what we did for your buddy Paul,
Yeah.
because he basically had thinning of the cartilage in the kneecap, and so
Hmm.
it creates a cushion and it allows the kneecap not to rub, and that can last for a year, sometimes even 2 years, and it works pretty effectively. But
Yeah.
eventually, it does stop working.
Yeah.
But that's a great, like, that's for me as my first line treatment usually for like osteoarthritis or cartilage issues.
Can I ask you about, so you said it lasts for a year, and Paul's had really good success with it, and then he's just gotten his second shot with you, and I think it was almost a year later. You said it
Yeah.
stopped. You said it stops working, but as long as you keep redoing it, will it keep working, or does it eventually
No,
just?
that's the problem. For some, whatever, because it's a degenerative condition, right? Osteoarthritis.
Sure.
So degeneration is going to keep happening over time, and the hyaluronic acid is not modifying the disease process.
Okay.
So all it's doing is giving you a cushion, which is great, but eventually, after like probably most people I find after 5 to 7 years, it stops working,
Okay.
which is still pretty good. And then that's where you usually go to the next step, which is the platelet-rich plasma, which we talked about.
Sure.
And then after PRP, or potentially at the same time, or alternatively, you could use stem cells.
Okay.
And there's a lot to talk about with stem cells, which we can unpack. But
Yeah.
basically, I think the point is there's like a stepwise approach, and so you don't have to necessarily jump to the right to stem cells or right to PRP.
Hmm.
It just depends case by case. There are some cases, obviously, there's people who wait like 5, 10 years to come go see the doctor, and then you go see them, and their like knees basically gone. And it's like bone on bone, and it's like, okay, well, like you don't really have many options at this point. It's like knee replacement, or you could try stem cells, kind of thing, you know?
Yeah. So I think we talked about stem cells before, and I remember you telling me that the reason they couldn't do it in North America was because they didn't have the scaffolding process. Because I think people were under the assumption that if you just injected stem cells, they would go wherever they were needed in your body. And I think you explained to me that there was a process that kept them in the area that they were needed.
Exactly, like the 3D bioprinting and all that. But the technology has evolved in the last few years, because now we can actually isolate just the stem cells. The problem was like, and this is still the problem in North America, is like if I take your fat, or if I take your bone marrow stem cells and just inject them back in, those aren't really true stem cells. They're what's called progenitor cells. So that means they can turn into a few different types of tissue, but they don't really regrow tissue. What they do is they just reduce inflammation, and they can last for a few years. So when anyone's saying they're getting stem cell injections in the States or in Canada, they're not really getting stem cell injections. And it's a bad misnomer, because you have to isolate the stem cells. So what that means is you have to process it in a lab, and you isolate what's called the mesenchymal stem cells or mesenchymal stromal cells. And essentially you isolate them, and then you actually culture them and expand them. So you grow them for a certain amount of time. And then that's what you inject. That's purified MSCs, as it's called.
So let me simplify it for myself. So you're taking stem cells from the fat or the bone marrow. Does it matter which one?
Fat is probably better. It actually tends to have more regenerative capability, but even potentially better than that now is umbilical cord tissue.
Okay, so when you take those stem cells, so in North America, they're just re-injecting those stem cells. And what you're saying, the process that you're doing outside of North America is you're growing those stem cells into a different version.
Exactly. And that's illegal literally everywhere in the world except North America. So it's because of corruption and politics, if you're going to ask why.
I was just going to ask why. Is it I'm sure you can go down a long road with that, but is there a summary you can give me as to why? Like what?
Well, yeah, I mean, Joe Rogan had a guy named Brigham who's actually working with a scientist, Dr. Ian White, who's like this Harvard-trained scientist, and he's a scientist I'm working with, and we're partnered together on our proprietary stem cell product. But his buddy Brigham was on Joe's show, and Joe asked him the same question, and it was basically comes down to 70% of the funding that FDA gets is from pharmaceutical companies' donation. So
I see.
It's in their best interest to not have people using non-pharmaceutical interventions, including surgery, because surgery helps the whole system, right? It's a system that feeds itself. And people, they do cortisone, it eats away at their joints, and then eventually they need surgery, and then they have to be on pain meds. And
so it's a perpetuating money-making machine, is what you're saying. Exactly, so basically you're saying by using stem cells, we're going to heal people, and they don't want to do that.
Exactly.
So I get it. I've heard this before. So when you grow the stem cell, how does that work? Can you explain? I don't know. I know it's probably a really complicated process, but why is it better after you've grown it and cultured it? Like, what are you doing to it?
Yeah, it's actually pretty easy. Like we don't have to get into the culture mediums and how to expand it and all the technical stuff behind it. I think there's just two things people need to understand. One is what's called flow cytometry, where you actually measure the number of stem cells and you measure the different what's called CD markers, which are the different surface markers on the stem cells to make sure you have good quality stem cells.
Okay.
And so essentially, if I take like we were talking about earlier in North America, just to give you perspective, if I take your stem cells, or if I take just like non-expanded stem cells, you maybe have like 500,000, maybe 1 million. But in Mexico or in Italy or Dubai, where I'm working, we can expand them to up to 200 million. So their magnitude of order difference, and is more better. Yes, actually it is. There's a lot of research on that. Like you probably, for osteoarthritis, for different conditions, probably like somewhere between 10 to 50 million is the right amount. And so you have to expand it basically to get good results. And if you don't expand it, then you're just kind of getting mixed results. And so that's where, again, making sure you have a doctor who knows what they're doing with this type of stuff, and the right dosages are given.
So so explain to me how this came about with you starting in Toronto, working with bodybuilders and doing PRP. And then now, where did the phone call come from to Dubai, where you're like, we want you to come here and treat the royal family? And how did this transpire? Like, can you explain a little bit?
I don't know. It just seems like good luck.
you know what? No, that's not true. You don't say that, because you've had good luck because you've met a lot of great people, but you're very good at what you do. So I mean,
I guess we're definitely travels. And the cool thing is, like, it's almost like a secret society. Like I mean, I don't have millions of followers online, but
Yeah.
the people I treat are the people who run society. Let's just say that.
Yeah.
Like,
Okay.
let's just, the elite of the elite, the kings, the rulers, the highest paid athletes, stuff like that. It's pretty cool, who I get to connect with.
Yeah.
But the reality is, the reason why I think I got that was just because, yes, we were doing some cutting edge stuff, and what I did was I traveled the world. So obviously I had my mentor, Dr. Galli in Toronto, but I traveled the world. I went to Europe, I went to Asia, I went to America, and I just learned from different doctors. And then I kind of synthesized it all into my own approach.
Yeah.
And then my approach, and so then you just kind of become like an N of one, so to speak.
Yeah.
Like you're the only one, then I just kind of become the only one in the world who can do a lot of things and no one else can do it.
Yeah.
And then all of a sudden you're really sought after, and then people talk and word spreads. And the Dubai thing was actually funny enough. I mean, it was a fitness world because the trainer to the crown prince of Dubai followed me on Instagram. And then when this billionaire guy had an issue, they were like, who's the best in the world for like, PRP, because he wanted PRP.
Yeah.
But they're like, this, and then that's it. So
dude, that's incredible, man. It's such a good story. But people have to understand though, it's you're good at what you do, and obviously there's some luck involved, but you're also very, very available. Like
yeah.
I don't remember, I don't know if that's just my own VIP treatment, but I don't remember a time when I've messaged you and been like, I need your help, when you've been like, I'm busy. So like all of these things have to converge, which is like
Exactly.
the talent, the work ethic, all of it. And then word starts to travel, right? But you do work very, very, like you work all like 7 days a week. You're there, right?
Yeah, I mean, I'm always, I guess, working in a sense, because especially because of my business now, but it's also like I genuinely enjoy it. And like you said, I'm very accessible. Like even though, like, even with Instagram, and like, even though I get so many DMs, I try my best to keep up, and like
Yeah.
emails I always respond to, and messages and stuff like that.
Yeah.
It's just because like it's crazy. Like I've had so many stories where, like, literally I had one patient who came to Mexico because she had terrible, like, long COVID.
Mhm.
She had like breathing issues, and she was just like suffering. She saw every respirologist, and there's so many studies. There's been over 40 clinical trials on using IV stem cells for long COVID. So I was like, how come no one's offered this to you? And I just checked my DM, and I responded to her, and then like literally in Mexico, she was crying with tears because she was so happy that I responded to her on Instagram, and that I was able to help her.
Yeah.
Just because I listened to her, and like it just, so for me, it's like, it's amazing that I can help, like, potentially change someone's life by just like not ignoring things. You know what I mean?
Yeah.
So
Yeah.
so that's why it's like, yeah.
I have a question about when you say IV stem cell versus, is there a system where you inject the stem cell into an area versus the IV, and what is the difference and why?
Yeah. So generally speaking, the local injections are be like for, a large tendon tear or advanced osteoarthritis. We inject it into the joint and into the bone for advanced osteoarthritis. So that's actually called intraosseous stem cell injections.
Okay.
I was the first one in the world to use intraosseous expanded stem cell injections, but basically, even with non-expanded stem cells, so let's just give a framework so people understand. There's two main categories of stem cells. There's non-expanded and expanded. So expanded meaning you grow them. And
Yep.
then within that, there's adult stem cells and there's perinatal stem cells. So adult stem cells are obviously fat and bone marrow, which we talked about. And then perinatal obviously is like placenta, amniotic,
Yeah.
umbilical cord blood, umbilical cord tissue. So those are like the broad categories of stem cells.
Mm-hmm.
And so essentially what we're doing is we're taking the stem cells, and by expanding them, we're increasing the count like we talked about, so we can use it to treat advanced osteoarthritis in a local injection, or we can use it, like you said, as a scaffold, potentially for a large tendon or muscle tear, and then regenerate tissue that way. But IV, we do that for more like just like literally, I had some patients who were like, it hurts everywhere. Like my shoulder hurts, my knee, my knee hurts, my elbow hurts. Like literally. So you're just kind of like, okay, like I don't think it's practical to inject you in 100 different spots. So that's where, and so the IV actually has an amazing homing mechanism, and it actually can heal tissue throughout the body. And one of our clients, patients, he's openly talked about this. So Tony Robbins, he uses our product actually. And because he does it every 6 months just for longevity and anti-aging too, because it actually makes you younger at a cellular level. Because you're taking umbilical cord tissue, or you're taking amniotic fluid, and you're putting it through your whole body. So obviously it's going to have regenerative, anti-aging, longevity effects. Plus, now we know there's actually what's called immunomodulatory effects. Mm-hmm. So it's almost being called what's a stem cell transplant. So if you take a high enough dose, which is about 2 milligrams per kilogram of stem cells,
Yeah.
so if you're like, most people, that would be like, maybe 200 million because they're like whatever, like 70 kilos or something like that. But in terms of like what you do is you basically put them IV, and it replaces your body's old stem cells, but it also signals to your immune system, and it changes the environment of the immune system. Think of it like an ecosystem, like you're actually changing it. Like, have you heard of those? Have you heard of those poop transplants, like FMT?
Poop transplants?
Yeah, fecal
Oh,
microbial transplant.
no, I
No?
haven't. No, I haven't.
Yeah, well, if there's anyone listening who knows about inflammatory bowel disease, I'm sure they've heard of it. But I think a lot of people have heard of it now because it's basically you take someone's healthy poop and you put it into your and you put it into your colon.
Well, how does that help?
Because it has good bacteria in there, and then it changes it's changing the ecosystem. And so this is the same concept.
Okay, wait. How do you know what's good poop and bad poop? I don't understand.
There's analysis based off the bacteria. So yes.
Okay.
Yeah.
Sorry.
There's good bacteria and bad bacteria, like probiotics, right?
I
like
know there's good and bad bacteria. I just don't know how you separate it.
Yeah, they analyze it. There's a way to analyze it now. So it's pretty
cool.
You
take that and you inject it back, or you put it back into the colon?
Yeah.
Wow. Okay. Let me go back to the IV treatment. You were saying that you're injecting, 200 million new stem cells. And you say they replace the old cells, but what happens to the old cells? Like, what happens to the older cells that are already in my body? I know this is a stupid question. I apologize, but
no. What's actually happening is that I guess it was a bit of a misnomer, but essentially what happens as you age is the amount of stem cells you have, the reserve you have, decreases.
Okay.
So just to give you an idea, when you're born, you have about 200 million stem cells per cell. So you have like trillions of stem cells. Sure. And then by the time you're 80, you have only 1 million stem cells per cell. So that's a huge decrease, right? So essentially your body's, it's one of the hallmarks of aging. It's called stem cell exhaustion. So stem cell exhaustion is basically your body's depleted of stem cells. And so you're replacing and increasing the amount of stem cells in your body.
So sorry, go ahead.
No, but I think the important thing to emphasize is you're also changing the immune system. So you're making your body, because I think 70% of your immune system's in your gut, right?
Yeah.
And so this helps with the gut lining. This helps with reducing inflammation in the gut, which is why it's such a powerful tool. That's why a lot of our pro athletes are doing it just in the off season every year, because why not, right?
So me and you have discussed this for many different reasons, but one of the things we didn't talk about was IBS. So I have some symptoms of IBS, which is irritable bowel syndrome, for those that don't know. So this potentially could repair that as well.
Yeah, for sure. Because IBS has to do with like what's called gut dysbiosis, which is like imbalances in the bacteria, gut inflammation. So this can help to repair the gut lining. And that is one of the reasons why people have IBS symptoms. It's because the gut lining becomes damaged.
So forgive me, all these are very basic questions. I don't, I'm not a scientist.
No, that's what we want.
Yeah. So if you over time are losing stem cells and things are aging, obviously, does that mean things like your pancreas? These people talk about, your pancreas being exhausted from releasing too much insulin and whatever. Like, does this mean all of that can be refreshed to some degree?
Well, there's actually there's clinical trials on the word cure is a strong word, but there's actually trials on curing type 2 diabetes using stem cells. Really? And then they're using it for Alzheimer's, using it for Parkinson's. They're using it for basically, think of any degenerative condition, like, and obviously in your case, we talked about chronic kidney disease.
Yeah.
Anything degenerative in nature, stem cells can treat, slow down, or potentially even cure if with the technology as it advances. So it's actually remarkable because think about it, most conditions are degenerative, right? That's the problem in society, right? It's degenerative conditions. It's like coronary artery disease, cancer, it's osteoarthritis. These are the things that plague people. And how do we combat that or prevent that instead of just putting people on pharmaceuticals for the rest of their life? And so that's where these treatments come in. And that's why, Joe Rogan and Tony Robbins and all these people are promoting it openly now, because we know it works, and the pharmaceutical companies can't really do anything about it anymore.
So let me ask you this. When we talk about heart and you talk about regeneration, how does this affect cholesterol? Because I know, obviously plaque buildup in the arteries is an issue. Can stem cells help with that in any way, or is that not connected?
Not cholesterol directly, but the reason why people get heart attack, or the reason why people actually get problems with cholesterol is because of what's called inflammation and oxidative stress. It's
Okay.
when the cholesterol becomes oxidized, or
Yeah.
when the inflammation around the cholesterol is so high, it causes it to become unstable, and then the plaque goes off and then it ruptures and causes like a blockage.
Yeah. Yeah.
So basically, the stem cells can prevent or treat heart disease in a sense, yes, because, and there's been trials on that, is because of reducing inflammation and reducing oxidative stress.
Okay.
So you're targeting the underlying mechanisms that actually cause coronary artery disease, because cholesterol isn't the problem, right?
Yeah.
Then that's why you have to look at, when we've talked about this before, you have to look at what's called the fractionation of the cholesterol, the particle sizes, the oxidation, all the inflammatory markers,
Yeah.
coronary calcium score. Like there's such a bigger picture,
Yeah.
and most doctors, like, I mean, I think a lot of doctors are starting to educate themselves, but like a lot of doctors are still like very outdated.
So the reason I asked though is I kind of understand the way the plaque works and how it breaks off and blocks the artery, but is the plaque buildup in the beginning? That's not, I mean, that shouldn't be there, right? Like the original,
yeah,
the original plaque buildup in the artery lining is not supposed to be there.
no.
Okay.
But that's a combination of cholesterol and chronic inflammation. And that chronic inflammation is something you can reduce definitely through stem cell treatments.
But you won't be able to reduce any of the plaque buildup that's already there. You're basically just reducing inflammation so the plaque buildup doesn't break off.
Exactly.
Okay. Okay. So how would somebody, I don't know if you can answer this, but how would somebody not eliminate, but if they're starting out, they're 20 years old, they don't want to have plaque buildup when they're 40. How does somebody stay away from that? Like keep from having plaque buildup?
Well, just the usual stuff like high fiber, exercise, low stress, like meditation, all that, lifestyle stuff, basically.
Yeah.
And if you have a high genetic propensity to it, then there are medications, obviously, like we talked, like I think, like, cholesterol and PCSK9 inhibitors, which are the ones.
Yeah, we've talked about that. I kind of want to get into the PSK9. Is it PSK9?
PCSK9.
PCSK. Okay, so that's a new one that's actually been prescribed to me through Merrick Health that we discussed.
Yeah, why did they recommend it? You should share with everyone, I guess. Why did they recommend it to you?
Well, I mean, my cholesterol was high, and I think they said that it was to protect my heart, protect me from a heart attack, is what they were saying. Is because the inflammation was high also in my markers. So maybe you can explain better than I can why they.
Well, yeah, but the problem is that, so the traditional medications, which are called statins, which are cholesterol lowering drugs, they actually aren't that, like, they're okay, like, but there's something called number needed to treat, which is like how many people have to take this medication to actually prevent a heart attack. And the number needed to treat for cholesterol or for statins is actually like something like 1 in 200. So it's actually not that effective. So whereas PCSK9 inhibitors are, I think I remember reading something like 1 in 10 or something. So it's like potentially 20 times better.
Okay, but what does it actually? How does it actually do? Like, what's the mechanism of action? Do you know?
So I believe, actually, I think it's a monoclonal antibody. So what that means is it works by blocking the production of the cholesterol instead of lowering the cholesterol like the statin does, it helps to decrease the production of it.
Okay. So I'm supposed to start using that. But the real reason I wanted to bring you on was an issue that a lot of bodybuilders have, and that's kidney disease. A lot of bodybuilders struggle with kidney disease, and it's for many different reasons. One, steroid abuse. One, obviously your weight being high. Obviously eating tons of food, and all these contributing factors that could lead to kidney disease. High blood pressure, which is I think my predominant reason why I have it. But you were telling me that there is a lot of studies now that show that stem cells are helping regenerate kidneys. So in the past, the common theme has been once your kidneys are gone, they're gone, and you can't really replace whatever's damaged. You can only just hope to keep it where it's at. And now you're kind of explaining to me that stem cells can help me bring my kidneys back. So what does the process look like, and how promising is it?
Well, every organ, as it degenerates, gets what's called fibrosis or scar tissue, to component of it. So you can get obviously like lung fibrosis, like that happens after COVID, liver fibrosis or cirrhosis, which happens to a lot of alcoholics. And in kidney, obviously that case with a lot of anabolic steroid users, they get decreased kidney function and they get scarring and fibrosis as well. So will it regrow you a new kidney? No. But what it will do is it can help to regenerate some of the fibrosis or scar tissue and damage that's in the kidney, which can increase the kidney function. And like you were saying, there are trials on this, and there's many trials being done right now. The most effective way to do it is actually to do it a combination of IV, and then you can actually inject it into the vein that feeds into the kidney directly, and then that can help to regenerate and increase the function of the kidney. So it's exciting because up until now we basically had no option. It was basically just like wait and see what just nothing, and just hope for dialysis, and then just like what But now it's exciting. We can like we said talking about earlier, the principle. I think if people can remember one thing, it's stem cells can fight any degenerative process.
Sure.
So and then that includes kidney disease too, right? Because it's degenerative.
Does that include hair growth?
Yes.
So I can grow my hair back.
Even gray hair. There's some people you can even get rid of.
Okay, wait a minute. So I've been told by, and I know we're going to go back to the kidneys, I promise. But I've been told from hair transplant companies that I can't get my hair back because I've already lost too much, I guess. So
give me 2 years. We're going to be so we have our own regenerative medicine company, but and we're just scaling right now. So we have a proprietary, but we're going to be acquiring the stem cell company in the States that basically you can take one hair follicle from the back of your hair, and you can use stem cell technology like we're talking about to expand it. So you can grow you could grow 5,000 hair follicles, and then you just implant them one by one.
Can I be the first trial person?
For sure, of course. But the company is already there. They're doing an FDA approved clinical trial. It's going to be a huge business because so many men want that.
I get first crack, right?
Yeah, of course.
Okay, this is live. We're going to record this.
Yeah. Okay, hold me to
it. Okay, more importantly, going back to kidneys, it's important because, like you said, for me, for example, I've seen a nephrologist, and he's basically said to me, look, we got to keep your GFR, your creatinine levels where they are, and there's no way to bring them back up. Let's just keep them here. And as they go down, like you said, you're at dialysis, and then the next step after that is hopefully a kidney transplant to keep you alive. And that's pretty much all the options we have. So what is the potential success rate that you know of, or how likely is it that this is going to really help me regenerate any of my kidney function?
So in terms of making a meaningful difference, it does work. Like you're gonna notice some sort of change. Like, is it gonna go from back to normal? No, but it can, generally speaking, you're gonna go from like anywhere from 25 to 50% increase in kidney function, which is still pretty significant. And that can, and then again, the other big thing is, okay, let's say even if it goes 10%, but the big thing is it slows down the degenerative process, which is huge, right? Because instead of going this direction, you can now go in the other direction, or at least you can stop and slow it down. And that's the big thing about stem cells, right? Is that at least you can slow down the degenerative process, and those are called disease modifying drugs. But now this is obviously a disease modifying intervention. So it's disease modifying because it's changing the natural course of the chronic disease, which is normally just going down, down, down. So that's the cool part about it.
This is insane to me that you have a technique that can solve diabetes, liver issues, kidney issues, heart issues, and the FDA is just saying no. Like, it's crazy to me that, because a lot of people might be skeptical. They're like, well, if it's this powerful and it's this helpful, and I understand the money side of things, but like, I can't understand why nobody has made a more concerted effort to make this available to people.
I think that's why, like, look at Panama, Mexico, Colombia. Like, why is there pop-up stem cell clinics everywhere around the States? It's because there's probably I think by now, millions of people have been treated by that. And that's the other thing. There is a lot of research on it too, but I think there is also power in numbers and anecdotes. It's kind of like, I always say, like, do you need a randomized control trial on knowing whether or not parachutes work? Are you not going to use a parachute because there's no studies on it? Like, there's doctors who think like that. Like, they're just asinine, and they're just like you've seen thousands and thousands, if not millions, of people being treated by stem cells at this point. Can you not accept the fact that they might work? And there's just more and more data every year coming out about it. And even look at me. Like, I came on your podcast a few years ago, and I was kind of skeptical about it. But now it's like the data has evolved, and and as a scientist, I'm always trying to prove myself wrong. I'm not gonna. And COVID is a perfect example of that too, right? Like, I mean, I was always on the cautious side about the vaccines and about the lockdowns, but now all the data's coming out. It's like, hey, we probably shouldn't have done that. But
Yeah.
but there's a lot of doctors who won't admit they were wrong,
Yeah.
and that's just being intellectually dishonest, which is unfortunately very common in my community.
So you are in Dubai. Who are you predominantly treating there? You're treating mostly anti-aging. How many athletes are you treating while you're there?
No, it's not a lot of athletes. Actually, Big Ramy is going to be coming, I think, next
Is
week
he?
or something. But yeah, so
Let
we
me
could
let me
talk about that because it was interesting because I think he lost Olympia because of his lower back, his multifidus muscles probably weren't as well developed as they should have been.
What's the multifidus? I'm way off.
Yeah, it's the muscle at the bottom, like those big striated lower back muscles, like
Your erectors?
your rectors, yeah, and the
Yeah.
multifidus is one of the muscles in the rectors, yeah.
Okay. So let me ask you, actually, I'm glad you brought that up. So when you look at Ramy's back double bicep from like 2013 to now, the lats have come up quite a bit and almost look like they've disappeared, for lack of a better word. So is he seeing you to try and regenerate that? Not for that, but is that something that you can potentially
Yes, well,
do?
he obviously, the reason why that's happening is because he most likely has. I've only connected with him recently, is because I have to look at his MRIs, but most likely he has degenerative disc disease, which is where in the spine obviously the discs start to degenerate, and then because of that, the muscles around there can start to atrophy as well.
Okay.
So it's like one thing leads to another. So
Sure.
we're gonna most likely have to treat his disc, and then we're gonna have to obviously treat the muscle as well. But the cool thing is, yes, the stem cells can help to regenerate the muscle. And then if you treat the underlying problem too, then he can hopefully build back that muscle over the next year.
Okay. So it's not so bodybuilders now that have issues with muscle tissue not being what it used to be can actually repair that. So like my tricep, for example, can we fix that? Can you give me a new tricep?
Well, you already had surgery on that, so.
Oh, I already fucked it up. All right.
No, yeah, but we'll see what we can do for you when you come down here.
All right. So what exactly are we going to do? Can you walk me through it? So I come down there, I fly to Dubai, I get in. How is the system set up there? Is it like stuff I've heard on Rogan where you're in Panama and they have their own hospital and their own hotel and it's all like connected? Or what is the system in Dubai? How is it there?
Yeah, we have our own. They do have a hotel they affiliate themselves with, and we do have everything in house. So we're the only facility in all of Middle East that has stem cell manufacturing, and also the only clinic approved to do stem cells. So
Okay.
that's why. So we kind of have a monopoly on it in this region.
Yeah.
And basically, what we do is we expand the stem cells in house. But we don't have to necessarily use your own stem cells, because if we know you're coming from out of town, typically we'll just use donor stem cells. And then so they'll be ready to go. We just need like a 3 days notice to get them ready and everything.
Mm-hmm.
So whenever you come in, we'll get them ready and prepped. And then you come in, the IV itself only takes 1 to 2 hours. And then depending on if there's any like injuries or nagging spots that you want tuned up, or if we see your tricep is degenerated or weakened, then we can put some in there. Mm-hmm. And then it's pretty much it. It's a pretty painless treatment, and it only takes a little bit of time. And then
sorry. So I come in, I stay the night, the next morning, it's like a day treatment. Like you get it done in a couple hours kind of thing.
Yeah, exactly. That's it.
And then am I good to go? Like I get up and leave, or like, do I have to like stay in bed for a day?
No, that's it. You just monitor your blood pressure for 15 minutes, make sure you're good, and then you're good to go. And the side effects are pretty minimal. Like sometimes people might get nausea, headache, like worst case, maybe a fever for 2-3 days if you have a strong immune response. Yeah. And then they're good. And so that's why it's such a minimally invasive treatment that's kind of just like, why wouldn't everyone do this? And yeah, and it's becoming like that, where it's like if you can afford it, pretty much everyone's doing it.
But I could flip that and kind of say I think people aren't doing it. It sounds too good to be true. So basically, I fly to see you. I lay in a bed for a couple hours. You inject me in a whole bunch of places, and I walk away, and then I'm new. It's like it sounds
exactly. You're younger, and we're putting an IV, so you're younger on a cellular level. You're healthier. Yeah. We've probably potentially increased your lifespan based off the biomarkers and the studies. And then we've also slowed down the degenerative process. So why wouldn't and then you can increase like some of my pro NHL guys who had it done. They said their concentration, their mood got better. I had one NHL player who was 35 and he was thinking about retiring. And he had the IV treatment done. And then within 6 months, he said he felt like he was 25 again. And then he's not going to retire. So
maybe I'll do the Masters Olympia.
Next year.
Okay, this is honestly it's crazy. Like so how long would I take? So after I leave, I just next day I get back on a plane and I take off. how long before I start to feel like my elbows feel better, my knees feel better, or like maybe my breathing is better, like my kidneys markers are better? Like how long before I see stuff in my blood work or feel anything?
Yeah, most of the time it'll take like minimum 3 months, but it can take up to 6 months, I would say, is when most people start seeing those type of changes.
Okay.
So it does take time because, again, you're modifying your immune system, and that modification of the immune system is going to take time. It's not overnight. Although there are some people where for example, in chronic pain, their pain is very inflammatory. And then as soon as you give them the IV stem cells, they feel better with it. They're like, oh, my pain's all gone within a week or two. And
Really?
that's just because their pain was so inflammatory related, and the stem cells are so anti-inflammatory. But it's different if you're looking at more like, chronic disease and like, breathing and kidney and stuff like that.
So acute issues we would notice right away, but chronic issues are
Yeah,
gonna,
like pain.
yeah.
Yeah.
Okay. Crazy, man. So what is it going to be? Have you worked on the King yet?
Actually, I am probably in a week or two. Yeah.
Are you nervous? What's it like? Does the King walk in? He's
Oh
got
yeah,
like,
they just hold a gun to your head, and if you screw up, you're dead. But other than that, is
I don't think you're allowed to say that.
I know. Yeah, so you're gonna have to cut that out.
No, seriously, like I think people have a lot of misconceptions about what that's like. So
No, the culture here, they're
no,
so
I don't mean
hospitable.
that. I don't mean the guns. I don't think people. I'm saying like,
Yeah.
but what's it like? Like, do you treat him? Does he come to you, or do you go to the like?
Usually you go to their palace and you do your thing and bring your stuff there.
Yeah,
Sometimes, but with Alabar, I was gonna treat him at his palace, but then he ended up coming to the clinic to see me. And he's, like I said, even though he's not a king, he is actually the real king of Dubai because he built Dubai.
yeah.
He's like the most successful businessman in all of Middle East, and
Yeah.
he even though he has a palace and all that. He just came to the clinic and I did my treatment for him over there. But it's high pressure, right? Like, especially that was my first time coming to Dubai in March and treating him. And it was just like probably the highest pressure situation I've ever been in my life in terms of treating a patient,
I was
because
gonna say.
you can't, if you get an infection, if something happens, like you're in trouble. So you have to, you got everything, and you gotta, you want to not try to hurt them too much, and you want to do everything like perfectly. And but it's good. Like I succeeded in that situation, and I treated his wife too. And his wife had like an issue for 6 months; she couldn't sleep, and because of me, she could sleep, and so he obviously loved me, and like because he's friends with all the royal family guys, so he recommended me to them. So that's once you treat the
How it all
top guy,
goes. Yeah.
they all know each other, right? And so now I'm just like on this whirlwind of treating billionaires and celebrities and all this stuff. So it's kind of fun.
I'm so happy for you, man. This is so
Thanks.
crazy.
Yeah, I know. It's funny how it started with. I remember my first Instagram post was actually with you, and it was just like just you and me, like being like, "Let's go see Dr. Khan. He's doing blood work," and it was like I had like 2 followers, and it was just
You
like,
know how it started because I didn't know Dr. Galia's daughter was working out at World Gym.
oh,
And I was like, and then somebody told me, they're like, I'm like, I was complaining about pain or something. And they're like, that's Dr. Galia's daughter. So, and I didn't know how to get in to see Dr. Galia. So I went and asked her.
yeah,
And then she set me up with the appointment. But when I got there, he sent me to you.
yeah, yeah.
So I was like, oh, I'm being passed off to the assistant. But now it's been the best. It's the best thing ever that's happened to me. So
Yeah, exactly. Yeah, I'm always gonna be grateful to him, but I think I mean, we're not working together anymore just because I've moved past. I've actually moved past probably what even he's doing,
Yeah.
just because he's still at PRP, but PRP is great, but stem cells are definitely the future. And on that note, we're actually I got recruited to build a hospital in Mexico. And we're going to build this is going to be the first regenerative medicine hospital in the world. And it's going to be 4 stories, beautiful. And we're going to have gene editing, 3D bioprinters, and all sorts of cool stuff that we'll be the world's first to do. So
what is gene editing? What does that mean?
I'm sure you've heard of CRISPR, right? Have you heard of CRISPR technology?
No.
You have. So CRISPR is like it's a big conglomerate of like the first gene editing technology, which is basically where they can use a specific enzyme to target specific genes and actually edit them, meaning you can either cut them out or you can change them to kind of do what you want.
So like if you have a gene that's like hurting you in some way, you can just take it out of your body.
Exactly. So gene editing. So that's why it's being used to cure certain genetic conditions that are just purely genetic. But most conditions aren't purely genetic. They're what's called epigenetic, which means like the environmental inputs on the gene change how those genes get expressed.
Okay.
So it's all about transcription factors and those and then so But the cool thing now, what we can do is we can use gene editing with stem cell therapy, meaning you can edit the stem cells using gene editing therapy to do what you want.
Okay,
So
wait.
this sounds like science fiction, but it's actually already being used. So there's a treatment called CAR T. So you take the T cells, which are part of your immune system, like, and then you use gene editing technology and then you edit the T cells to target the cancer cells, for example, in like hematological cancers, and they actually cure cancer because they're actually killing the T cells. I mean, they're actually killing the cancer cells.
Yeah.
And the same thing with like they use it for lupus. There was a trial using CAR T for that. And this is just the beginning. So gene editing and cell therapy together, and tissue engineering, which is a 3D bioprinters, like all three of those together, are going to revolutionize medicine. And I'm excited to be part of it. And that's why we started a company. We started a company called Regenerative. We're a startup, but we basically have our own proprietary stem cell product, which we're manufacturing and we're selling to other clinics.
Yeah.
But we're also going to be getting into, eventually into gene editing and cell therapy and everything. And the cool thing about being in Dubai is when you have a startup company, and it's very easy to get investors. So it took me all of 3 days to raise $10 million. So
That's good. It pays to know the right people. No.
yeah, well, really, yeah.
So let me go back to the gene editing thing, just so I can simplify it for myself. So when people talk about hereditary disease, like if I have like my dad had a heart condition. So when people say that's passed down to you genetically, is this what you're talking about? So we can like change that?
Yes, you can change the way that gene is going to express itself using gene editing and cell therapy. Yeah.
Wow. Okay.
So
That's crazy, man.
And that's the future, right? And that's why pharmaceutical companies are suppressing this as much as possible, because you're not going to be just managing symptoms anymore. You're actually going to be treating people and putting them in remission, or curing them altogether. So if chronic disease management goes away, which I think it will in 20 years, it's going to take probably 20 years, but it will happen in our lifetime. And eventually pharmaceutical companies won't be just managing people anymore. Instead, regenerative medicine companies will be curing people and putting them in remission and actually treating them. So, and that's why regenerative medicine, there's so much money being poured into it. There's a lot of startups out there, and our company is very focused on large scale development, but there's a lot of companies that are focused on incurable diseases and all sorts of other stuff. So it's a really exciting time, and it's fun to be, part of this world.
Can you explain briefly or not briefly, can you explain what 3D printing is? 3D bioprinting. What is that?
Yeah, so it's called basically it's biomaterials. So you use what's called bio ink.
Okay.
So it's essentially you're using like a material that can print cells, basically.
Okay.
And then you can actually grow cells, or you can print cells, and then you can grow scaffolds, which are synthetic scaffolds as well. So the reason you would want to do that is because, for example, if you want to regrow a kidney, we're not there yet, but in the foreseeable future, we can use 3D bioprinting to print the cells and print the scaffold that you need to actually grow a kidney, and then you can implant it into a person.
So instead of waiting in a 5-year line to get a kidney transplant, now you can just make one.
Exactly. And that will be available. My timeline on that's probably 2030, 2031, because they're already starting to do animal studies on it.
There has to be some drawback to creating a kidney from nothing. Not from nothing, from stem cells, but how to that sounds scary, man.
I know,
just creating organs, like, you know what I mean?
Well, didn't you hear about the first embryo that was, or like synthetic embryo that's created just from so that was a thing, right? So basically they created an embryo just from cells in the petri dish. So it's like, are you playing God at that point? Like, I don't know, right? Like you're just creating things, and so it becomes very, there's like, it controversial, and like there's lots of like obviously ethical issues behind that too. But I think people aren't going to be creating embryos and using them just for whatever sake. Like that's very unethical, obviously. But where I do see it is, there was actually a Nobel Prize that was given out a few years ago for what's called induced pluripotent stem cells. And that's where you can take any cell in your body. So I could take your muscle cell or your fat cell, and I can turn it into a naked stem cell. So
what's a naked stem cell?
So like
it can be anything.
It can be anything. Exactly. Yeah. Okay. So, and that was the new reason it was given a Nobel Prize, obviously, was because it's such a huge discovery. So they're called iPSC cells, and there's so much research being going into iPSC cells now, because if you can reprogram cells, then you can kind of get them to do what you want, right? And then that's really the future of medicine.
So obviously for people with good morals and good ethics, this is all a very positive thing, to be able to treat people and all that. But walk through this with me for 1 second. Just on a philosophical side, when people are like, hey, people are supposed to die at a certain time, or people are supposed to, degenerate, like,
Yeah.
does this philosophical argument play into your mind at all? Or you're like, listen, I'm helping people, period. That's all I care about.
Well, I think from like the philosophical perspective, longevity and anti-aging have been a thing that humans have been chasing for since the beginning of time, basically, like looking for the elixir of life.
Yeah.
So I think it's something we've always wanted, and now it's actually going to be potentially become a reality. And I don't think that's a bad thing. I think we just have to, it's not like you're going to be able to live forever. There's no, like, people who are trying to cure aging are living in a delusional world. Like, you can't cure, you're not gonna be able to cure aging, but you can, I think, using gene editing and cell therapy and all that, you can definitely slow it down. And personally, like, I do the IV stem cells on myself. I'm gonna do them every year. Just why not, right?
Yeah. You do them on yourself?
Yeah, because I mean, I have access to it, and it can help me live longer, and I'm young, and so I'll hopefully won't age, and I'll be I'll be
How
like,
long? How long have you been doing it on yourself?
just I started this year because that's when I started getting into it. So
Have you noticed anything?
yeah, I've noticed more energy, better sleep. People said like my skin, like my face looks. I always kind of look on the younger side, but like you look young.
Even better.
Yeah, exactly. Yeah, and then, but the idea is, I think realistically, like, they're saying the Generation Z will live till at least 100, but like I think they're underestimating. Like I think even millennials, we can, with the right IV therapy, with even what we have now, you could probably like 120, 130. I think it's gonna be very common.
So this is kind of expensive at this point for the majority
Exactly.
of
So,
people. Do you think this will reach a point where
oh, for sure, because it's just like any other technology. So the biggest reason for the expensive cost is what's called cell manufacturing, which is where you have to grow the stem cells. And this is important for people to know because, when you're going to Panama and when you're going to some of these places, the quality control isn't the greatest. So making sure you're training, making sure they don't have infection and making sure you're getting good quality stem cells. So I work with one of the top scientists. I work one from Harvard, Dr. Ian White. You can look him up, and he's like literally the godfather of stem cells. And then working with Dr. Giuseppe Mucci here in the east, like Italy and Dubai and all that stuff. And he's a world-renowned scientist, and he manufactures cells, but he has a patent on manufacturing cells. It's about 10 times cheaper than it used to be. Okay. So it's going to bring the cost curve down significantly. And so we're just in the process of acquiring that patent. So we're going to be able to manufacture cells at a much cheaper price than anyone else in the world, and then we can distribute and sell them. And then instead of being 20,000, it'll probably be more like 10,000. And then, as the demand goes up, and eventually you might be able to even bring it down even more. I think the best analogy I always say is it's like electric vehicle batteries. Batteries used to cost $400 per kilowatt hour, and then now after 10 years, they cost $100 per kilowatt hour. So it went down, like so much. And that's the same thing with stem cell technology. They used to actually cost like 40 to 50,000.
Yeah.
And now it costs about 20 to 30, depending where you go. So I think, yeah.
So is that the full cost? So just, and obviously everywhere is different, but let's say your clinic in Dubai. If somebody from North America wants to go there, obviously they got to pay their flight and hotel and all that stuff. But what is the actual treatment cost for someone like me if I want to go there and get whatever
you
I
get
need
you get the special rate, but
okay, but let's say the average person goes there and they get and they want to get whatever it is, their hair or their kidneys or whatever.
If they want to get the IV, kind of like full body treatment, generally that's going to be between 20 to 25,000 US dollars. Okay. But I am doing it in Los Cabos too, and I'm doing it in Italy. So there are closer places. Sure. I'm doing it in Italy in May, and in January during the All-Star break, because I have a few pro guys flying down. Yeah. But I'm doing it after the NHL and NBA season in May because I have a bunch of the hockey, like so many of the pro athletes. Like, why wouldn't they have multi-million-dollar contracts? Yeah. Like there's literally no reason.
Why wouldn't you spend the 20 grand? Yeah.
Obviously. Exactly. Like, for them, it's like a no-brainer. So they all want it. They all want to do it.
Yeah. That's so crazy, man. So yeah, it's quite pricey. But if somebody said to me, look, you got to take out a loan for a new kidney. If somebody's going because they want to get their knee pain fixed and they don't have a lot of money, that's a little different. But if somebody says, hey, you have kidney disease or you have a heart condition or whatever, I mean, it's worth taking out a loan if you have to get something like this done, if it's actually going to work. You know what I mean?
Yeah. And I think that's the big thing. I found a lot of people I was actually shocked at how many people were willing to do it who were willing to stretch themselves a little bit thin,
Yeah.
just because they're people. It's changed, right? Even like millennials, but like obviously even the older generation and even Gen Z, like everyone's so into health and longevity now.
Yeah.
Like it's really the sentiment, especially after COVID. Like there's such a distrust of pharmaceutical companies,
Yeah.
and people don't trust them, and like they want to take health into their own hands, which is great. And so people are willing to spend money on their health now. Like it's
Yeah.
a really different time we're living in.
The thing is, though, even with the anti-aging, and I'm not saying stem cells is like this, but even with the anti-aging movement, I guess you want to call it, there is some things that are kind of shady. Like people take
Oh, there's so many snake oil
this
sales.
this pill will keep you from being older, or this supplement, or this. Do you think people are going to put stem cells in that category for now until more people start doing it?
I say 5 years ago it was in that category, but now
Yeah.
there's just so much research on it, and like you
Yeah.
can't really fight it anymore. Like there's
Yeah.
like stem cells are being used to treat over 80 medical conditions.
Really?
Like, and so like how can you say stem cells don't work or they don't have any effectiveness? And there's just so much data on it, and the data is it's just piling up more and more, right? And um, it's one of those things that you're going to see you're eventually, like there's always early adopters, right? I'm an early adopter obviously as a doctor from what I'm doing, but I've always been on the innovative and pioneering side of things.
Yeah.
But I bet you anything, like I can in 5 to 10 years you'll see pretty much every doctor talking about it or offering it.
Yeah.
And it's just like it's kind of like, plastic surgery was in the 1980s, where very few plastic surgeons were doing cosmetic surgery, and the ones who were super super successful because they're on the pioneering of it. But then
Yeah.
by the 1990s, it wasn't just celebrities doing it; it was everyone was doing it.
Yeah.
And that's kind of the way it is now with stem cells. I think right now it's really accessible to wealthier people, influencers, people who are able to access that stuff. But in 5 to 10 years, probably everyone will have access to it.
Yeah. So the only other question I have about the stem cells is, like PRP, you said there are levels to who can do it and who can't. How should someone go about finding a stem cell clinic that they can trust or that is reputable? Is there a way to know who's going to be good and who's not?
Well, obviously, our brand Regenerative is going to be supplying a lot of those clinics, so
Sure.
you can look for Regenerative supplying them, which we will be over the next year. And then the other thing is, so the two biggest things that we do and that you should look for are flow cytometry. So ask the clinic if they're doing flow cytometry, which is like the analysis of the stem cells and the cell markers.
Okay.
And then two, ask them about quality control. Like 50% of the money we spend on cell manufacturing actually just goes on quality control. So we're spending a lot of money on quality control just to make sure there's not infection and making sure you're getting the right count and all that stuff. So those are the two biggest things. And like there's a lot of people taking shortcuts so they can save money, but then that can, like if you get an infection or if you get something bad, like this can be devastating, right? So you got to make sure like this is not a joke, right? It's IV treatment. Like it can screw you up if you're not doing the right treatment.
Well, I was going to ask, if you get an infection at that level, like that deep a level to the
Yeah,
cell, like,
you get sepsis and you end up in the hospital and you could die. So you have to really,
wow.
like, yeah.
Okay. So you're in Dubai, then you're in Italy, then you're in Los Cabos.
Yeah.
So my question to you is, how do you have such a pleasant family and wife that they're willing to just travel the world with you and not complain that they have to be towed around everywhere?
No, it's true. Like, I mean, courage takes support, and I'm very lucky. I have a very supporting family and friends, and they're the best. So I'm lucky, and they're plus. I mean, my kids are kind of young; they're only 3 and 1, or 3 and 2. So they're for them it's fun to travel around and whatever. But probably in a few years it might be harder for them. But yeah, we're all over. We're opening up a clinic in Fort Lauderdale too. Actually, we just got the Florida Panthers facility. So
that's awesome.
The professional hockey team. So they there was obviously there's so many people who wanted it, but they gave it to us, or me mainly, because we can attract people from all around the world to their place.
Yeah, that's so good, man. Good for you.
It's gonna be pretty cool. And like we're gonna be in a hub in Florida, and we can treat all these US athletes. So it'll be awesome.
How much stuff do you have to buy your wife for her to be okay with all this?
Let's just say I'm a regular at Chanel and Dior.
How good has Dubai been though? Are you doing a lot of stuff there other than work?
Dude, it's on people like like I would say everyone should come visit Dubai at least once in their lifetime.
Yeah.
Not just the grandiose of everything, but honestly, there's a lot to experience food wise. It's incredible. They've really built it to be like the best city in the world, and it's
Yeah.
not a lie when they say that. And the food, it's like the food, the experiences, everything. Like, and there's like if people think it's really expensive. Yes, there are like, but you can get like a $20 meal, you can get like a $2,000 meal, right?
Yeah.
So
Yeah.
there's something for everyone, and it's not necessarily bad. Like the New Year's Eve party we went to, like it just like the guy I was with, he hosted us, and but it was $100,000 table. Like I was just like,
Fuck.
yeah, exactly. So
Yeah. Yeah.
I was just like flabbergasted. I was like, well, I love you for inviting me. Like I got to admit, it's like the best. It's like the best view in the city. We're in front of the Burj Khalifa. We could see all the fireworks, but it was 100K just to sit there.
What's the $100,000 dinner taste like? What do you did? What
Oh,
did you?
it was stupid. It was like a 15-course meal. It was like there was I don't know, there was like foie gras sushi. There was like truffles. There was like gold. Like it was just stuff. It was like over the top. I mean, it was just like I'm a simple guy. Like, but it was. I mean, yeah, it was amazing. But you know, I don't think that stuff is necessarily going to make you happier in the long term. It's just, you know, and I think that's the problem with a lot of people chasing wealth and stuff like that. It's called hedonistic adaptation. It's like hedonism. Like your body, you get used to it, right? And then you just kind of want more and more. So don't chase that. Like that's why obviously you know me. Like I love what I do because it's meaningful and I get to make a difference in people's lives. Not about money.
I was just going to say that about, you know, you've been very successful and you've traveled the world and obviously you've made a good financial, you had good fortune that way. But I've never ever felt from being around you or talking to you that was at all the purpose for what you're doing. It's not like you're saying like, I'm going to open this clinic and make millions. I really feel like you have just a passion for what you're doing. And I think that's the nicest thing to see.
Exactly.
So,
And even with our regenerative medicine company, me and Dr. Ian White, the reason we joined ventures was because both of our vision is to help millions of people with our technology. But when you help millions of people, you become a billionaire. Like that's just what happens. But that's not my goal.
It's like it was an accident.
Yeah, like I don't care if I do. Like great if I do, but if that's not my goal. But my goal is just to help people. But when you help people on a large scale, yes, you become wealthy. Like that's just how life works.
This may sound silly to you, but I feel like I'm going along a ride with you.
Yeah, no,
just because I only say that because I knew you from the start. So I feel very happy talking to you now and seeing all this stuff going on. So it's just great. It's great.
No, it's amazing. It's dude, like it's funny because like it actually like a lot of it did start with you, and I mean, it did actually. The first few posts, you good first podcast, everything. So you made a huge difference, and that's why. I mean, obviously, I'll take care of you as a doctor, but if I'm looking forward to our relationship in the future too, like both of our successes. You know,
I want to show just real quick so people can follow you and ask questions if they need to. This is Dr. Khan's Instagram. Some of the people he's treated, and you also lift, which is cool. This is you in Dubai.
Yeah, that's the guy who built the Burj Khalifa. Yeah,
this guy.
Yeah, he's the richest man in Dubai. Mohammed Alabar. Yeah,
that's crazy, man. So I want to see if you have any treatments here anywhere. What is this you're doing? Finishing PRP on my spine. So you have some athletes.
Yeah,
here.
that was we did PRP into his disc, and then a lot of health advice. Samson, oh yeah, he was
Samson did
he's
not.
A funny guy. He's so scared of. He's like this gigantic. He's like probably the biggest bodybuilder I've met in my life, and he was scared of like a needle this small.
He really did not like the needles.
But he felt better in like a week. He said his tricep and his shoulder pain went away. So I was so happy, and he placed amazing in Olympia. So dude, he's gonna be like. I'm glad he's your athlete. He's gonna be like. I think he can break top 3 in the next few years.
Yeah, he's a very nice guy. But I was shocked. I was really shocked at his fear of needles. But you've really, there's Frank McGrath here and Mike Van Wyck, and you've really treated and worked with
Robin Black. He's a UFC announcer, friends with Joe Rogan.
Where is it? Oh, here.
Robin Black.
Yeah. Good for you. So listen, if anybody is watching and they want help with stem cell, PRP, anything to do with injury or
even autoimmune conditions, now we're treating long COVID. Honestly, like I'm becoming kind of like, because my scope is broadening, because I'm not I wouldn't say I'm just a sports medicine doctor now. I'm like more like a regenerative medicine specialist.
Yeah,
Um,
I hate when I put you in that box, but it's how I know you. But I know you're
No,
doing
for
a lot
sure.
more.
Yeah.
Yeah,
I've
yeah.
definitely grown. I've definitely grown in the last 2 years because I'm doing clinical trials with stem cells and I'm working with scientists from around the world with stem cells. So, and we're able to, like I said, over 80 conditions with stem cells. So I'm treating patients with like ALS, like MS. I have patients like even there's autism protocols. Like there's lots of different things we're doing. So it's pretty exciting. So I think I would say like not everything, but like for the most part, if you have a medical mystery or you're not sure where to go, I'm happy to help because I also happen to know a lot of the top doctors around the world. So even if I can't help them, I can probably connect them with the right person who can.
Yeah. So for those people who can't afford to go see you abroad, when are you back in the GTA?
I'll be there for a few weeks in April, and then I'll be back, and then I'll be gone to Italy and then Florida. Like I honestly don't know how much time I'm going to spend in Canada. Like my family's there, so I'll still come. But like Canada's like our government and like our,
I
I mean, it's
know.
our business. Like it's tough, man. Like the business, the politics, like it's going backwards, and there's no innovation, and like they're just and the regulatory bodies are terrible, and there's so much corruption. And the funny part is, I actually had a phone call with Doug Ford before I left, and like he wants to have a meeting with me in person, so I'm going to meet with him in Ministry of Health when I come back in April. So if I can make some sort of change on that level, I'll try. But like I'm not very hopeful because he's surrounds himself with a lot of people who are just have their own agendas in mind, and they don't really care about people. They just care about unfortunately money. So
Yeah. Well, the only reason I asked is I know a lot of bodybuilders in the GTA that want to see you. So I guess they can message you on Instagram, and if they can get in to see you, they can. And if they can't, they're gonna have to fly abroad to see the best.
that's pretty much it.
That's kind of how it goes. All right,
Yeah.
doctor. Listen, I appreciate you coming on. I appreciate you explaining the process and giving people so much information. Thanks for taking the time. Is there anything you want to cover or talk about before we go?
No, I'm here in Dubai till April, so I'm excited to big Ramy's coming and a lot of other, like I said, the royal family people. But if I'm happy to just treat regular people too, and we do like we do sometimes do hardship pricing and financial plan. Like we try to make it work for most people. Like so, I hope people don't shy away just because of the money, just because like sometimes we try our best to help people. I've even done it free of charge for some people who are on disability and stuff like that. So.
Okay. Well, you shouldn't have put that out there because now everyone's going to be like, I'm...
No, but that's obviously if you're,
I know.
People aren't going to lie. Hopefully people won't lie and say they're on disability. And
All right, man. Listen, doctor, I had a great time talking to you. We will catch up soon. I'm going to fly to Dubai here in the next month or so.
Awesome.
And see you, and hopefully you'll fix me up.
Great. All right. Thanks again.
Good talking to you, man. Thanks for watching. Please subscribe, share with your friends, and like the video. And if you get a chance, check out the description for all the different links to all the different places you can find HOSSTILE and myself. And lastly, check out HOSSTILE.com for our new line of supplements and all of our apparel and gear. Thanks again for watching.